Thank you very much, Sven, even for this very nice, interesting presentation and overview of the technology. And so, last presentation before the Q&A session, presented by Simon. Simon is responsible for the transnational access coordination at EUNCL, and he will tell you how you in the room can get access to EUNCL and what is the process, what you get if you are selected. Simon, the floor is yours.
Thank you, Patrick. Thank you, everybody, for joining this session. I'm here as the, let's say, more operational person in this presentation, since I will present you the way to access EUNCL, what we so-called TNA. TNA is for transnational access. It's more a nanomedicine multi-platform characterization access, and I'm going to try to briefly explain you how to access, what are the procedures, the successful application profiles, and lesson learned from this first TNA call we run early this year, and we are finishing to select and will be done by the end of October, and the evolution in the implementation of the future calls. So the application process is divided in two parts. There is a first step, we call it step 1, very simple. It's a kind of, let's say, medical nanoparticle description in a nutshell, where you have to, let's say, implement the most relevant and detailed information about your medical nanoparticles, coping with critical selection criteria. Among them, there is the capacity to produce 2 independent batches of your medical nanoparticles, and to provide as well some details in terms of production process and scaling up strategies. The third one is the demonstration of efficacy in a biological system, either in vitro, but we prefer in vivo, of course, and to propose a clear strategy to transfer the technology to the clinical environment. So after you have processed this application, it will be reviewed by 2 boards. One is an external expert board, which we call PEB, Peer External Review Board, involving independent experts in nanomedicine and nanotechnology. It's a double-blind cross-review for each applications. We have, let's say, the EUNCL core expert team is also involved in this review with an additional technical and feasibility review process and expertise sharing, both in medical with medical and industry perspective. And at the end, there is a consensus meeting gathering all the reviews. And then if the application is selected, you go to step 2, where the expectation is more, let's say, important, with this full submission documents and extended selection criteria. We are really waiting for a complete and detailed description here, and let's say there are 2 different ways to propose a step 2. One is a full dossier, a written document, and the other one is an oral presentation, which we will favor based on the expertise of our US cousins, because it really favors and facilitates the interaction with you, the sponsors, and it really reduces the work amount as well. So the criteria for this step 2 are, let's say, the strategy and the concept behind your nanoparticle, like what it is, what it does, how it works, its unicity, for example, the previous characterization data, among them synthesis, purification procedure, physicochemical characterization, in vitro safety and efficacy, and of course in vivo studies for if any, let's say. The other ones are the anticipated impact on the clinical application and maybe comparison to the standards, therapeutic options. The manufacturing process will be extensively discussed, as it is really critical for the purification steps, the potential impurities, the cumulative amount of APIs, for example, the batch-to-batch variability, such things. It is a really critical point. And we're also going to discuss the inherent toxicity of your particles in terms of safety and environmental issues, and the strategy of to translate your nanoparticle in the clinical use. So this is the step 2, which is going to be reviewed internally by EUNCL, and let's say that's why we're also favoring the oral presentation, because it really is the process of evaluation, since we have a direct contact, and the question and answers can go really smoothly during those evaluation. After that, we are, let's say, moving forward. There are most certain documents, legal documents, that has to be exchanged as well, the MTA, the NDAs, in order to work safely together. And we will then move forward for the characterization. So I can a brief feedback about the first session our first TNA call we had. The applicant profile was quite homogeneously distributed, with 1/3 of SME and industry sponsors, 1/3 as university, and 1/3 as research institutes. So we had, let's say, 1/3 private, 2/3 public. We have had 9 applications total, which is not that bad. 6 were eligible because the first call was organic focus, IV route, and cancer. Among those 6 eligible, we have 5 which have been selected to step 2, and I'm finalizing the answers to those sponsors, which will come very soon. We have had several technologies. We have had liposome, micelles, polymers for the organic ones, and we have had also 3 non-organic, inorganic particles. The most important drawbacks we have experienced in those applications were key data missing. Among them, no or limited in vivo efficacy. Most of them presented safety data, in vitro and in vivo safety, but very small presented efficacy data. Some characterization data were missing as well, but that's maybe not the most important thing since we're here at least to provide some. We have had some lack in the production and material availability, which is as well critical in terms of production process description. They were usually very loose, unclear scaling up strategies, and material availability, both in terms of quality and quantity, was not described always, and we have a very rare description of the stability of the molecules. We have had some absence of characterization assay description as well, and some of low innovation level as described previously. We are really expecting innovation here. Before going to the timeline, just trying to describe you what makes a successful application to our let's say, mind. The applicant's profile is not what we're looking for. The application profile, except if it is not well written, is not the criteria, and the technology profile is, apart from being not innovative, not a critical one. Data and data quality are the main, let's say, concern in the application. So what makes a successful application? Fulfilling the call lines, of course, that's really a basic. Proposing innovative technologies, that is also very key. Presenting a wide characterization data sets, not all, because we're here to complete and support you in collecting those characterization data. Providing in vivo efficacy data, at least in vitro, I would say. And presenting concrete production process and realistic scaling up plan. So, in terms of timelines, we have had our first call for access. The call was presented. We have had 9 responders, as I presented. We are going to go to the second step for the interviews, and after that, when the selected sponsors will be, let's say, approved, we will run, as described by Sven-Even, the first pre-screening step, which is a go-no-go step, since we have had an experience from our US cousins. That's most, let's say, 60% of them are failing in the pre-screening part because of contamination mostly, and some additional reasons, but mostly because of contamination. So the pre-screening is really a go-no-go step, and then we will go further in the full cascade with the physical, chemical characterization and the safety assays. So that is globally the timelines we're expecting so far. So what will change in the future regarding the EUNCL call campaigns? We will go through a continuous application process with 2 review sessions, one in April, one in October. We are opening to inorganic, and for the 3 inorganic application we had in the first call, we will directly review them in the second review session in October. We are opening additional routes, injection, oral, and sprayed, and we are opening additional disease like infectious disease. The initial one was cancer focused, but we're moving to additional disease. And here are the contacts you can use, either the website, everything is described, and the links are also put in. There's a dedicated email address, and I'm your contact person, and the next review session should be organized and will be organized in October this year. Thank you for your attention.
Thank you very much, Simon.